Hello and welcome. If you are over 60, or if you love someone who is, this video may change the way you see doctors forever. What if I told you that some of the biggest risks to your health are not your age, not your illness, but the assumptions made about you the moment a doctor sees your birth year on a chart? Behind polite smiles and professional language, many seniors are quietly labeled as too old, too complicated, or not worth aggressive treatment. Symptoms are brushed off as normal aging. Questions are met with rushed answers. Powerful treatments are never even mentioned. This isn't bad luck. It's a system. And it's happening in exam rooms every single day. In this video, we're going to expose the uncomfortable truths no one warns seniors about: how age bias silently shapes diagnoses, medications, and life-changing medical decisions. More importantly, you'll learn how informed seniors are turning these moments around, reclaiming their voice, and demanding the care they truly deserve. This isn't about fear. It's about awareness, dignity, and taking back control of your health. If you've ever felt ignored, rushed, or talked down to by a medical professional, stay with me until the end, because what you're about to hear could protect your health and possibly extend your life. If this message resonates with you, please like this video, subscribe to the channel, and share it with someone who needs to hear the truth. Medical ageism is far more common than most people realize, and it often begins before a senior says a single word. The moment an older patient's age appears on a medical chart, an invisible judgment is frequently made. Not spoken aloud, not written down, but deeply embedded in the system. Older adults are often seen as expensive, time-consuming, and medically complicated. This isn't usually driven by cruelty or bad intentions. It's the result of years of systemic pressure, training, and incentives that quietly shape how care is delivered. Modern healthcare is built around speed, efficiency, and measurable outcomes. Doctors are given limited time per patient, shrinking reimbursement, and growing administrative burdens. In that environment, seniors are often viewed as high effort, low return. They typically have multiple conditions instead of one clear diagnosis. They may take several medications. Their symptoms can't always be solved with a single test or a quick prescription. All of this clashes with a system optimized for fast decisions and simple cases. As a result, older patients are more likely to receive shortened appointments, fewer follow-up questions, and narrower diagnostic thinking. Instead of asking why a symptom appeared, the system jumps to, "This is expected at your age." Instead of exploring root causes, care becomes conservative, minimal, and protocol-driven. What makes medical ageism especially dangerous is that it's often invisible to the patient. It hides behind polite language and reassuring phrases. "Let's not be too aggressive. We'll keep things simple. At your age, comfort is the priority." These statements may sound compassionate, but they can quietly limit access to tests, treatments, and life-extending options that would be routinely offered to younger patients with the same condition. Over time, this bias doesn't just affect medical decisions. It affects confidence. Many seniors begin to speak less, ask fewer questions, and downplay symptoms because they sense they are being seen as a burden. This self-silencing reinforces the very stereotypes that caused the problem in the first place. The truth is simple but powerful. Age alone does not determine resilience, intelligence, or treatment potential. Two people with the same diagnosis can have vastly different outcomes, regardless of age. Yet when systems prioritize cost and convenience over individualized care, seniors pay the price, often with delayed diagnoses, unnecessary suffering, or lost years of life. Recognizing that medical ageism exists is not about blaming doctors. It's about understanding the system clearly so you can navigate it wisely, speak with confidence, and protect your right to be treated as a full human being, not a number on a chart. For many seniors, the appointment begins with the label, long before the conversation begins. The moment a doctor opens a medical chart and sees an advanced age, a quiet mental shortcut often takes place. Without realizing it, many physicians categorize older patients as high maintenance, time-intensive, and clinically complicated. This label isn't written anywhere, but it shapes the entire interaction that follows. Medical training emphasizes efficiency. Doctors are taught to assess how much time, testing, and follow-up a patient is likely to require. In busy clinics and hospitals where schedules are overloaded and pressure is constant, age becomes a quick filter. Seniors are assumed to need longer explanations, more tests, and more careful medication management. The result is a subtle but powerful shift in behavior. Instead of curiosity, there is caution. Instead of exploration, there is limitation. Doctors may interrupt more quickly, steer the conversation toward a single main complaint, or avoid asking open-ended questions, not because your concerns aren't important, but because they fear opening a door they don't have time to walk through. Complex stories don't fit into short appointments, so they are trimmed down, simplified, or quietly ignored. This labeling also affects clinical decisions. Some doctors hesitate to order comprehensive testing for seniors, worried that results may reveal multiple issues requiring long treatment plans. Others default to standardized senior protocols rather than tailoring care to the individual in front of them. The goal becomes managing the visit, not fully understanding the patient. The most painful part is how quickly this labeling can shut down meaningful dialogue. When a senior senses impatience, the rushed tone, the shortened answers, the glance at the clock, many instinctively stop sharing. They choose which symptoms feel worthy of mentioning and which to keep to themselves. Important clues are lost, not because they weren't present, but because the space to share them never truly existed. Over time, this pattern becomes self-reinforcing. Doctors see seniors as difficult because appointments feel complicated. Seniors feel unheard because doctors rush. Both sides lose, but the consequences fall hardest on the patient. Being labeled doesn't mean care is denied outright. It means care becomes thinner, faster, and less personal. And in medicine, what is not asked is often just as dangerous as what is missed. Understanding this dynamic is not about resentment. It's about awareness. When you recognize that labeling happens automatically, you can prepare, organize your concerns, and assert your needs clearly. Because your health deserves time, attention, and respect, regardless of the number printed on your chart. One of the most dangerous consequences of medical ageism is how serious symptoms are quietly dismissed as normal aging. For many older adults, the first warning signs of illness don't arrive loudly. They appear as fatigue, shortness of breath, loss of appetite, mood changes, or subtle pain. These are not minor signals. They are often the earliest indicators of heart disease, cancer, endocrine disorders, or clinical depression. Yet in older patients, these red flags are frequently waved away with a familiar phrase: "That's just part of getting older." This assumption creates a false sense of reassurance. Instead of investigating why a change has occurred, the healthcare system treats decline as inevitable. Chest discomfort becomes anxiety. Persistent tiredness becomes age-related weakness. Memory changes are labeled senior moments. Emotional withdrawal is described as a natural response to aging, rather than screened for depression. What makes this especially dangerous is that many serious diseases present differently in older adults. Heart attacks may show up as fatigue instead of sharp pain. Thyroid disorders may appear as low energy rather than obvious hormonal symptoms. Cancer can progress quietly, masked by vague discomfort that doesn't fit textbook expectations. When doctors rely on age-based assumptions instead of clinical curiosity, these conditions slip through the cracks. Delayed diagnosis is not a small issue. It changes outcomes. A condition caught early may be manageable or even reversible. The same condition discovered months later can lead to permanent damage, loss of independence, or shortened life expectancy. In many cases, seniors aren't diagnosed late because tests are unavailable, but because symptoms were never taken seriously enough to justify testing in the first place. This pattern also affects mental health in profound ways. Depression and anxiety in older adults are often dismissed as loneliness, grief, or life stage adjustment. While emotional challenges are real, they do not cancel out the possibility of treatable mental illness. When psychological symptoms are minimized, seniors suffer in silence, believing their distress is something they must simply endure. Over time, this repeated dismissal teaches older patients to question themselves. They stop reporting changes, fearing they'll be seen as complaining or dramatic. This self-doubt compounds the problem, pushing diagnosis even further out of reach. Aging does bring change, but it does not erase the body's warning system. Pain, fatigue, sadness, and discomfort are messages, not background noise. When serious symptoms are mistaken for aging, the cost is paid in lost time, lost health, and lost trust. Recognizing this pattern is the first step toward protecting yourself and insisting that every symptom at any age deserves to be heard and evaluated. Medical gaslighting is one of the most subtle and most damaging experiences older adults face in healthcare. Unlike open neglect or obvious discrimination, gaslighting hides behind calm voices and reassuring smiles. It sounds polite. It sounds reasonable. Phrases like, "That's normal at your age," "Everyone slows down eventually," or "You're worrying too much" are delivered as comfort. But their effect is the opposite. They quietly dismiss real concerns and shift the focus away from investigation. For seniors, this kind of dismissal carries extra weight. Doctors hold authority, and when a medical professional repeatedly tells you that something is just aging, it becomes easy to doubt your own experience. You begin to wonder if you're imagining things, overreacting, or failing to accept reality. Over time, that doubt becomes internalized. This is what makes medical gaslighting so dangerous. It doesn't just delay diagnosis, it rewires behavior. Older patients stop pushing for answers. They delay follow-up visits. They minimize symptoms when talking to family members. And when conditions finally reach a critical stage, the question becomes, why didn't you come in sooner? As if the system didn't play a role in silencing them. Gaslighting also follows predictable patterns. Physical symptoms are reframed as emotional issues. Emotional symptoms are framed as personality changes. Fatigue becomes laziness. Pain becomes sensitivity. Memory problems become jokes. The message is consistent. Your experience is less credible because of your age. Women and men experience this differently, but both are affected. Older women often hear that symptoms are hormonal or stress-related. Older men are told emotional changes are simply part of aging masculinity. In both cases, legitimate medical concerns are filtered through stereotypes instead of evidence. The psychological impact is profound. Being repeatedly told that your discomfort is normal trains you to tolerate suffering. You lower expectations for care. You accept decline as unavoidable, even when treatment exists. This erodes trust, not just in doctors, but in your own instincts. And here is the truth many seniors are never told. Aging does not invalidate symptoms. A symptom that disrupts daily life is not normal, simply because of age. Normal aging does not cause sudden loss of energy, unexplained pain, persistent sadness, or drastic changes in function. Medical gaslighting thrives on silence and compliance. It weakens when patients ask questions, request evidence, and insist on clarity. Recognizing gaslighting isn't about confrontation. It's about reclaiming your right to be believed. Because when your body sends a warning signal, your job is not to dismiss it, and neither is your doctor's. One of the most harmful assumptions in senior health care is the belief that age automatically means cognitive decline. Long before any assessment is made, many older patients are quietly treated as if they cannot fully understand complex medical information. Doctors simplify language, shorten explanations, and avoid detailed discussions, not because the patient has shown confusion, but because of an age-based expectation. Intelligence, education, and life experience are overlooked in favor of a stereotype. This assumption shapes treatment in subtle but serious ways. When doctors believe a senior cannot manage complexity, they often withhold advanced treatment options. Cutting-edge therapies, clinical trials, multi-step rehabilitation plans, or nuanced risk-benefit discussions are skipped entirely. Instead, the recommendation becomes, let's keep it simple. What is rarely explained is that simple often means less effective. Medical decisions are then made for older patients rather than with them. Choices that require active participation, learning, or monitoring are quietly removed from the table. Informed consent becomes incomplete because not all options are presented. The patient may never know what was possible, only what was offered. This cognitive bias also affects medication choices. Doctors may favor once-daily drugs with weaker therapeutic impact over more effective regimens that require careful timing. The priority shifts from optimal outcomes to perceived compliance. In trying to avoid confusion, the system often sacrifices effectiveness. The damage goes beyond treatment quality. When seniors are spoken to slowly, oversimplified, or talked down to, confidence erodes. Even highly capable individuals begin to doubt their ability to understand medical information. Over time, this creates a self-fulfilling prophecy. Patients disengage, ask fewer questions, and rely entirely on authority, not because they must, but because they've been conditioned to. Technology adds another layer of discrimination. Many healthcare providers assume older adults cannot use patient portals, health apps, or digital monitoring tools. As a result, seniors are excluded from systems that improve communication, tracking, and early intervention. This digital gatekeeping further isolates them from modern care. The truth is uncomfortable but clear. Cognitive ability varies between individuals, not age groups. Some people in their 80s manage businesses, study new skills, and navigate complex systems with ease. Others may need support, and that should be assessed, not assumed. Treating every older patient as mentally limited is not protective. It is paternalistic. Respectful care means offering full information, explaining thoroughly, and allowing the patient to decide how much complexity they want to engage with. Because dignity in healthcare is not about simplifying reality. It's about trusting people with the truth and respecting their right to choose. One of the darkest realities in senior health care is the use of medication not to heal, but to control. For many older adults, prescriptions are written not because a clear medical condition has been diagnosed, but because certain behaviors are considered inconvenient. Restlessness, anxiety, frustration, assertiveness, or persistent questioning are often treated as problems to be managed rather than signals to be understood. The solution, too often, is medication. Sedatives, antipsychotics, and mood-altering drugs are frequently prescribed to seniors under vague labels like agitation, anxiety, or sleep disturbance. These terms sound clinical, but they often mask a lack of proper evaluation. Instead of asking why a person is distressed, pain, fear, medication side effects, loneliness, or untreated illness, the system reaches for a chemical shortcut. This practice is especially common in hospitals, rehabilitation centers, and long-term care facilities, where staffing shortages and time pressure are constant. Medicated patients are quieter. They ask fewer questions. They require less attention. From an operational standpoint, sedation looks like efficiency. From a human standpoint, it is a loss of autonomy. The consequences can be devastating. Sedatives increase the risk of falls, one of the leading causes of serious injury and death in older adults. Psychiatric medications can cause confusion, balance problems, memory impairment, and emotional flattening. A senior who was once alert and engaged may appear suddenly declining, when in reality the medication is creating the very symptoms it claims to treat. Even more troubling is how these drug-induced effects are interpreted. Confusion caused by sedatives may be labeled as dementia. Apathy caused by mood stabilizers may be diagnosed as depression. Sleep medications can disrupt natural sleep cycles, leading to chronic fatigue that invites yet another prescription. The cycle feeds itself. Pain management reveals another form of control. Some seniors with legitimate pain are undertreated because providers fear dependence or believe complaints are exaggerated. Others are over-medicated to reduce expressions of discomfort. In both cases, the patient's experience is shaped by convenience rather than care. Families are not immune to this dynamic. Exhausted or overwhelmed relatives may be reassured that medication will calm things down without fully understanding the risks. Once behavior is chemically suppressed, it becomes harder for the patient to advocate for themselves or even express distress. True medical care seeks to restore function, clarity, and dignity, not suppress personality. Medication should never replace investigation, communication, or compassion. Every prescription deserves a question. What condition is this treating? How will we measure improvement? And when will we stop? Without those answers, treatment becomes control, and the cost is paid in lost independence, identity, and life itself. Perhaps the most painful truth in senior health care is that life itself is often evaluated through an economic lens. Behind closed doors, medical decisions are not shaped by compassion alone. They are influenced by formulas, budgets, and cost-benefit calculations that quietly assign different values to different lives. In these systems, the remaining years of an older adult are often judged as less return compared to those of a younger patient, even when medical potential is similar. This mindset affects treatment long before a patient is aware of it. Expensive surgeries, advanced imaging, aggressive cancer therapies, and organ support treatments may be described as too risky, not appropriate, or unlikely to benefit. Language that sounds medical, but often hides financial reasoning. The same intervention offered readily to a 40-year-old can be discouraged for a 70-year-old with an almost identical health profile. What makes this especially troubling is that these decisions are frequently framed as kindness. Families are told that comfort should be the priority, that aggressive treatment would be too much, that it's better not to put an older body through stress. Yet many seniors, when given full information, choose treatment, not because they fear death, but because they still value life, purpose, and independence. Preventive care also suffers under economic valuation. Screenings, early diagnostics, and mental health interventions are sometimes withheld on the assumption that seniors will not live long enough to benefit. This creates a tragic paradox. Conditions that could be managed early are ignored until they become emergencies, costing more, harming more, and limiting options. The emotional impact is just as severe. After repeated exposure to minimized care recommendations, many older adults begin to internalize the message, "My life is worth less now." They stop asking for second opinions. They accept reduced options. They make decisions based on what they believe society expects of them, not what they personally want. Emergency medicine reveals this bias most clearly. Older patients with the same symptoms as younger ones often receive fewer tests, shorter evaluations, and quicker discharge. The urgency feels different, not because the body is less vulnerable, but because the system has decided the outcome matters less. The truth must be stated clearly. Age does not erase the value of life. It does not negate resilience, recovery, or meaning. Many seniors respond exceptionally well to treatment and go on to live productive, fulfilling years that would have been lost if economic assumptions had gone unchallenged. Healthcare should be guided by medical evidence and individual goals, not actuarial spreadsheets. When cost becomes the silent decision maker, dignity is the first thing lost. Every patient at every age deserves the right to choose life and to be offered the full range of care that choice requires. One of the quietest tragedies of medical ageism is what happens inside the minds of older adults themselves. When a person is repeatedly treated as less urgent, less capable, or less worthy of effort, that message doesn't disappear when the appointment ends. It follows them home. Over time, many seniors begin to absorb the subtle signals sent by the healthcare system: shorter visits, fewer explanations, limited treatment options, and translate them into a painful belief. Maybe I really am asking for too much. This internal shift is rarely sudden. It develops gradually through small interactions: a dismissed symptom here, a rushed answer there, a treatment that is not recommended at your age. None of these moments alone feel dramatic, but together they create a powerful narrative. Your needs are secondary, your time is nearly over, and your role now is to accept less. As this belief takes hold, behavior changes. Older adults may stop advocating for themselves. They hesitate to request second opinions. They minimize pain and discomfort when speaking to doctors, family, or caregivers. Some avoid medical appointments altogether, convinced that nothing meaningful will be offered anyway. The danger is not just emotional, it is medical. When seniors lower their expectations for care, outcomes worsen. Early symptoms go unreported. Preventive care is skipped. Treatable conditions advance quietly. By the time help is sought, options are fewer, risks are higher, and recovery is harder. What looks like natural decline is often the result of delayed or diminished care. This internalized devaluation also affects decision-making at critical moments. Faced with serious diagnoses, some seniors decline treatment, not because they don't want to live, but because they believe treatment would be selfish, burdensome, or wasteful. They prioritize perceived cost to others over their own desire for life and dignity. This is not informed choice. It is conditioned resignation. Families may unknowingly reinforce this pattern. When elders sense impatience, financial worry, or emotional fatigue in loved ones, they may silence their own needs to protect others. The healthcare system, already predisposed to offering less, rarely challenges this withdrawal. The tragedy is that this loss of self-worth is not an inevitable part of aging. It is learned, and what is learned can be unlearned. Every human life retains value until its final moment. Worth is not measured in productivity, youth, or projected years. Seniors do not age out of deserving care, attention, or hope. Reclaiming self-worth begins with one powerful shift: refusing to accept less simply because of age. The moment an older adult believes their life still matters, the entire medical conversation changes, and that belief, more than any prescription, can be life-saving. The most powerful response to medical ageism is not anger. It is informed, confident participation. In a system that often underestimates older adults, the single greatest advantage a senior can develop is becoming an active, knowledgeable patient, not confrontational, not defensive, simply prepared, engaged, and impossible to ignore. When you shift from passive recipient to informed partner, the entire dynamic of care changes. The first step is asking clear, direct questions. When a doctor recommends or dismisses a treatment, ask why. What evidence supports this decision? What alternatives exist? What outcomes are expected, and over what time frame? Questions signal engagement, and engagement disrupts assumptions. A patient who asks thoughtful questions is no longer easily labeled as confused or compliant. Next, demand transparency. If a doctor says a treatment is not appropriate at your age, calmly ask, Would you recommend the same plan if I were younger? If the answer is no, request a medical explanation, not a financial one. This single question forces clarity and often reveals whether age, rather than health, is driving the decision. Documentation is another quiet form of power. Take notes during appointments. Bring a written list of symptoms, concerns, and goals. When doctors see you documenting the conversation, they slow down, clarify, and become more precise. Written records also protect you later, especially if opinions change or care needs escalate. Bringing a trusted person to appointments can be transformative. An advocate provides emotional support, asks follow-up questions, and serves as a witness to the interaction. Their presence alone often improves communication and reduces dismissive behavior. This is not a sign of weakness. It is a strategic use of support. Second opinions are not an insult. They are a safeguard. Medicine is complex, and no single doctor sees the full picture. Consulting another professional, especially one experienced with older patients, can uncover options that were never discussed. Many life-extending treatments are accessed only because someone refused to accept the first answer. Equally important is education. Learn the basics of your condition. Understand standard treatment pathways. Knowledge doesn't replace medical expertise, but it allows you to participate meaningfully in decisions that affect your body and future. Becoming an active patient is not about fighting the system. It's about navigating it with clarity and confidence. When seniors advocate for themselves, they not only protect their own health, they slowly reshape how the system treats aging itself. And that shift begins with one simple truth. Your life is worth understanding, explaining, and defending. The final message is simple, but it is one the world often forgets. Age does not diminish the value of life. Getting older does not make a human being less worthy of care, effort, or hope. It does not turn pain into something acceptable, nor does it transform illness into something that should be quietly endured. Age changes the body, but it does not erase the right to be seen, heard, and treated with the same seriousness as anyone else. Every older adult carries a unique health profile shaped by genetics, lifestyle, resilience, and lived experience. No two bodies age the same way, yet too often, healthcare systems replace individual evaluation with broad assumptions about decline. When this happens, medicine stops being personal and becomes predictive, not based on evidence, but on age alone. Respect in healthcare is not about promising immortality. It is about honesty, options, and choice. It means explaining diagnoses clearly, offering all reasonable treatments, and allowing the patient, regardless of age, to decide what quality of life means to them. Some may choose aggressive care. Others may choose comfort. Both choices are valid only when they are informed, not imposed. When seniors are respected, outcomes improve. Symptoms are reported earlier. Trust is restored. Decisions are made with clarity rather than fear. Families communicate more openly. Doctors practice more thoughtfully. Dignity returns to the center of care, where it belongs. This message matters not only for those who are aging now, but for everyone who hopes to grow old one day. The way society treats its seniors reveals how it understands human worth. If value fades with age, then every life is on a countdown. But if value endures, then aging becomes a stage, not a sentence. Older adults are not remnants of the past. They are living, breathing people with futures still unfolding. Some futures are long, some are short, but all are meaningful. The responsibility lies with both the system and the individual. Healthcare must reject lazy assumptions. Patients must reject silent acceptance. Together, these shifts create a space where age is acknowledged, but never used as a reason to care less. Because a life does not lose its worth with time, and no one should ever have to prove they are still worth saving. Conclusion. If there is one truth to carry forward from everything you've heard, let it be this. Aging does not mean surrendering your right to care, clarity, or dignity. The challenges seniors face in healthcare are not personal failures. They are systemic patterns that thrive on silence, compliance, and low expectations. But once those patterns are seen, they lose much of their power. You are not too old to ask questions. You are not too complicated to deserve time. And you are never a burden for wanting answers about your own body and future. Every appointment is a conversation, not a verdict. Every diagnosis deserves explanation. Every treatment decision should be based on your individual health, values, and goals, not on assumptions tied to age. When seniors speak up, prepare, and stay engaged, the system changes one interaction at a time. This is not about fighting doctors. It's about standing beside them as an informed partner. It's about reclaiming your voice, trusting your instincts, and refusing to accept less than respectful, evidence-based care. If this message resonated with you, please like this video, subscribe to the channel, and share it with someone who needs to hear it. Your awareness could protect a life, maybe even your own. Together, let's demand better.